Well, I came to Timpanogos not knowing that I was going to deliver at Timpanogos because I had to switch doctors due to an insurance thing. But I had a fantastic experience. I ended up having my baby 3 weeks early due to some weird liver things that were going on.
Well, it goes back a number of years. We're living in Provo, but in the past we lived up near the hospital in Orem. And our family doctor, Dr. Merrill, had set up several tests for my wife.
As far as emergency room, when I was in there, they seemed on top of it. Doctor came in right away. You know, they had me back pretty fast to get an x-ray, things, you know, and then when they found out that it was a heart attack, they were pretty on top of, I mean, right away I was up in cardio, knocked out, so that was good.
Our insurance changed between my 3-year-old and the boys, and we chose Timpanogos as opposed to another Mountain Star hospital because of the NICU.
I went to my doctor appointment on a particular day, and he sent me home, told me to pack and get ready to have the baby, which I was not prepared for. And I came to the hospital, and they were very welcoming, they were very comforting. They were informative, making sure I knew exactly what was going to be going on with my situation. And they just made sure that I was at home.
The person doing the check-in was just very friendly, patient. You know how you struggle to get all the different cards and get everything ready. Yeah. And place very busy, a lot of people waiting, but you'd never know it. The x-ray technician staff was just extremely friendly and helpful. And
it's always hard having a baby and giving birth because it's kind of it's not very private. Just the whole experience isn't. Clothing and then, you know, needing help to use the restroom afterwards, and everyone has always been really kind of just really respectful of privacy, but then also let me help you, but I never feel awkward there. You know, all of it's positive. I got really great feedback from the lactation specialist because I asked to speak with her. I loved all of my nurses. They were very respectful and kind.
The care for my baby was great. They took her during the night into the nursery so that I could sleep. And they changed her and fed her and took exceptional care of her. And then anytime any of the nurses would come in the room, when she was in the room with me, they were always very professional and, you know, sweet with the baby.
I like to eat, and we eat food that's a little different than what everyone else eats, and don't like pancakes and waffles and a lot of folks eat. So I got in touch with your dietary staff, and they did a fantastic job. I called back, the boss, I guess, there was out, and I called back to tell him thank you. And he said, would you like to pass your thanks on to the boss? And I said, sure. And a little bit later, in pops this smiling gentleman, your chief executive officer, who asked me the same questions you're asking about my food experience. And I was pleased, but also very impressed that in some organizations, and you could tell the way everybody acts, that the boss isn't walking around with a whip, neither are the supervisors and managers, and very, very impressed with his concern over a simple thing like a big thanks for the food.
I think the greatest experience we had there was with the NICU. When he was born, he had some issues. He had pulmonary hypertension and was placed in the NICU after turning blue a couple times for not getting enough oxygen. And so I would say probably, you know, not only was my doctor's care fabulous when I was still living and recovering, the nurses were kind of on top of my pain, but more than anything, they were also there like emotionally, because as a, you know, delivering a new baby, number one, you're emotional, but you also want to make sure that your child's okay. And so the greatest experience we had was really in the NICU. The nurses, took care of the babies. They loved the babies. They sang to the babies. They talked to the babies. And they also kind of talked with us about what was happening.
The staff is so well retained there that even 2 years later having this one, I knew all the same nurses. They asked about him. They recognized me and knew who I was if they didn't remember my baby exactly. I loved that I didn't have to travel. It was just so nice that the same place I delivered, the same place I was comfortable with, I could go and see him and walk down the hall, and my husband didn't have to go see him at a different time or a different place and leave me, and it was nice.
The nurses were probably the most positive part of the experience. In particular, Carolyn Rasmussen was my nurse with me most of the time. She was there when I had my epidural, and she was just so comforting.
I wish I could say yes, but when you're under the influence of narcotics, it's a little hard. All I can say is that everyone was very patient. Little things like getting up to go to the bathroom and getting the covers and sheets and everything fixed. And so I couldn't pinpoint. There was nobody that didn't treat me with great respect and love and care.
When I was receiving my epidural, she made sure that I was in the correct position and that I didn't see the needle or anything that would have been scary to me. And I also had to have some unexpected medicine during my stay. I had to have magnesium, which makes you really hot and kind of uncomfortable. And she explained the whole thing, made sure the room was at a good temperature so that I felt at ease.
One of the nurses, I told her I liked potatoes, and she brought me a big, huge thing of potatoes. It was a little much, but it was good.
The rest of the staff was great. They made sure that I, had my food, had my liquids. They made sure I had my Diet Coke after I had my baby, which made me feel really good. I even asked during the night when they come in and check your vitals, I was so exhausted from the whole situation that I even asked one of the nurses if she could wait until morning to come in and take my vitals, which was nice because usually they're in right in the middle of the night, and she did. So I got a little extra sleep too. I thought the facility seemed really up to date, really new, really clean, which made me feel at home because I'm kind of a neat freak, so it worked for me.
Hospital is clean. It's hard to keep a hospital clean because of all the traffic, but that creates a very good impression.
The recovery rooms were wonderful, very clean, very inviting, very comfortable to recover in. And then, of course, the food was fabulous, which I was actually shocked about. Usually hospital food is terrible, so that was actually nice.
Well, this experience was a lot different for me just because of the situation. I hadn't had the liver situation with my other two kids, so this was a completely new thing, having the baby early and the medication that they put me on and everything. So I would say that they were more attentive with me, which was awesome, given the conditions, and they were just really, really comforting.
We delivered our first one, who was a 33-week baby, so 7 weeks early, at Utah Valley, and it was a definite number. It was like, okay, you're out. It's time to get out. I don't know if that's okay to say. It's time to get out. And at Timpanogos, you did not feel like that at all. It felt like definitely everybody knew their names. They knew us when we would come in, even after the first day. Everybody knew who you were, knew which babies you were seeing. It was very personal.
After having my second, anybody, I'm like, if your insurance, if they'll take it at Timpanogos, deliver there, deliver there. So I know a few people who have kind of changed their plans to fit Timpanogos in because it's so
nice. Well, let's say this. Let's hope that it's for diagnostic purposes only, but yes, that would be the hospital of choice.